Hey, welcome back, Sweden, to your Caribou Data Science channel. And a big shout out today to the 43 people who watched the video yesterday. You know, that is the most number of views for any of my videos yesterday on YouTube, okay? Thanks so much for those 43 views. Of course, if you stay here at Caribou Data Science channel, 23 views or 43 views should equal 23 or 43 likes. So I'd appreciate it. Not only watch the video, but like the video. Of course, share the channel on the Facebook, share the video and the channel, Caribou Data Science channel on your Twitter and Facebook accounts. You can also share them in emails and text messages. So let's get started here with the show, Sweden. As we know, Sweden only records COVID-19 data Tuesday, Wednesday, Thursday, and Friday for some reason. I'd say that at this point, if someone actually knows what the official reason for that decision is, I would appreciate a note or a link in the in the I can't speak in the, in the comments below. Because of this fact, it basically means that we don't know what the actual week numbers, because this spike is always Tuesday. Then there's nothing down here until to Thursday. Okay, so we don't know what the numbers actually were for Saturday, Sunday, and Monday. So because of this, what we're going to do is we're only going to be concerned with the trend. The trend is our friend, and the blue line is the trend line. Okay, and what you can see sometime back in July, your cases started to increase. Now, what's interesting about that is both the United States and Israel and Ireland all showed an increase in cases beginning in July. Is this the variant? I don't know. But the point to keep in mind is this. Of course, this leads into my next little rant about vaccines. Should you get vaccinated? Absolutely. The older you are, the more important it is to get vaccinated. But here's the thing we have to understand, at least about the vaccines in America. That is, the vaccines in America will not keep you from getting COVID-19. And they may not keep you from dying from COVID-19. They simply reduce what they do is the vaccine does, it reduces the severity of the disease and it reduces the chances that you'll die from the disease. But none of those two things are guaranteed. So what this means is if a man, woman, and child can be vaccinated in Sweden, cases and deaths could continue to increase. Hopefully not as a fast rate, but they still could. Okay, so anyway, the trend currently now is back upward for cases. This is the 28-day moving average for cases. Each column represents the previous 28-day average. So for the 28-day period ending August the 17th, you were averaging 862 cases per day. Now look at this nice long declining pattern in COVID-19 deaths. Okay, what you see here is a long declining pattern. You are seeing a slight increase here. Okay, a slight increase here. Hopefully this is this. Hopefully that's kind of like this right here, a little dip, a little blip, and a little dip again. Okay, but nonetheless, your deaths are still crazy low. Okay, let's be honest about that. Your deaths are really crazy low. So for the 28-day period ending August the 17th, you were averaging 1.1 deaths per day. I don't know what you folks are doing in there, but whatever I don't know what you're doing, but your deaths are still remaining very, very low, and that's the good news. Okay, yeah, there's a bit of an increase in cases. Uh, is this the variant? I don't know. I can almost guarantee that these numbers, without the vaccine, you would be back up here someplace. Okay, that's my opinion on the vaccine. This has significantly reduced. Well, no, this hasn't reduced the number necessarily reduced the number of cases. Okay, but look how crazy low your deaths are right now. Okay, August cases. Look at this. Yeah, it's higher than the previous 2 months, but the August cases were well below this numbers all the way back over to here. Okay. What about this? Look at this. Look at this. One, two, three, four, five, six. Sweden, 7 months in a row, your COVID-19 deaths have decreased. I don't know what you're doing, but you should package it and sell it to the rest of the world, okay? Although they may not like your treatment. Okay. Anyway, so this that takes care of the report for today. Sweden, lots of good news on the deaths front. Don't allow yourself to get all worked up over cases and hospital beds, because Washington University Institute of Health and Elections Evaluation here in the U.S. says the single best measure of the spread of a pandemic is daily deaths, and your deaths are remaining very low. Okay, not hospital beds and not cases, because as we know with the vaccine, the vaccine may not even decrease the number of cases. It'll hopefully decrease the number of deaths, or at least slow them down, but it may not decrease it. The person ought to be decreasing them. Okay. Anyway, thanks so much for your time today, Sweden. Again, thanks. The big shout out to the 43 people who watched this video yesterday. Thank you so much for those views. And we'll catch you tomorrow with an updated report.